$120 million was recently awarded to a man and his family after the hospital in New York that he was cared for had a resident physician miss a stroke on the CT scan. Let's talk about this case, the diagnosis, and how this happened. In November of 2018, William Lee was a 41-year-old real estate broker. At about 3 a.m. in the morning, his wife heard a thud and found him convulsing in the floor, and she called 911. The paramedics took him to Westchester Medical Center, a hospital in New York, where a stat CT scan of his brain was performed to evaluate for stroke. That CAT scan was done promptly upon his arrival at the hospital, but was read by a resident radiologist. This means that this is read by a radiologist that's still in training. From some reports is that he communicated this with his attending physician, but those films were unable to be reviewed by that physician at the time. Remember, this is around 4 a.m. At 7 a.m., the films were then reviewed by an attending radiologist, and it was deemed that this patient had a basilar artery occlusion. This is a life-threatening stroke and an incredibly morbid stroke. If left untreated, 90% of patients with basilar artery occlusions will die. The basilar artery is the main artery in the back part of our brain that supplies our entire brainstem. The brainstem is kind of like the motherboard of the brain. If it doesn't work, nothing works. Strokes, and particularly in strokes like this, time is brain, so the more time that goes on, the more likely the patient will have brain damage. Mr. Lee promptly underwent thrombectomy after the diagnosis was confirmed. Unfortunately, he sustained permanent brain damage and now lives in a nursing facility dedicated to brain injury patients. From what I can tell, he cannot care for himself and will need long-term care. Basically, they think he's going to be in a nursing home the rest of his life. Unfortunately, this man cannot function anymore as a real estate broker or be there for his wife and kids. Was deemed in the court of law to be negligent by the hospital due to the delay in diagnosis. You may also ask, why does a 41-year-old healthy man have a stroke like this? And it was found that he had antiphospholipid syndrome. This is an autoimmune disorder that makes your blood more likely to clot. So back to the malpractice case. Why was a resident physician reading these scans without any backup? Typically, in the case of a stroke code, not only does the radiologist review these films, but the on-call neurologist also reviews these films, and in this case, a resident neurologist also missed the diagnosis. And did this delay in the diagnosis actually cause the brain damage? Well, we do know that these cases of basilar artery occlusion are extremely morbid conditions and have a high rate of neurological damage even with treatment. Again, I don't know the details of this case, and these are really hard cases to diagnose. Bottom line is the court of law found this hospital negligent and deemed that their actions led to this patient's permanent brain damage. The fact that these resident physicians did not have the support that they needed is extremely devastating, not only to them and their training, but to the patient as well. It's a perfect demonstration of how strained our hospital systems are. It's an extremely sensitive case, not only for the patient and his family, but for the physicians involved in this case. Let me know your thoughts in the comments section.